Años atrás, mi esposo me pegó. Estaba embarazada de 3 meses y él llegó borracho y me dio algunas patadas en el estómago, y cuando él mismo me llevó al hospital a emergencia, él mintió a los médicos que me había caído de las gradas. Sin embargo, él fue quien me pegó. Y aquel día, pues, nadie me preguntó en el hospital qué me había pasado. Simplemente escucharon la versión de mi esposo y yo quedé sin mi hijo.
My OBGYN asked me, was there any abuse going on at home? And I said no. And the reason I said no is because I thought she would have been obligated to report it. And living in fear, I didn't know what his reaction would be. I was thinking, oh my God, he could lose his job. And I didn't want that to happen. I was just so terrified. I didn't know what to do, so I said no.
As a primary care doctor, screening and prevention are part of what I do every day. Something that I do every day is I check to see if my patients had a mammogram. Well, it turns out that about 1 in 8 women will have breast cancer in her lifetime. But did you know that 1 in 4 women are victims of intimate partner violence? Yet we don't screen for intimate partner violence.
Well, the CDC defines the intimate partner violence as a serious, preventable health problem that affects millions of Americans throughout the United States. And it's really the coercion or harm done by a partner, a spouse, or anyone that is engaged with someone, whether they be a married couple, a same-sex couple, or teenagers.
And a lot of people think, am I in an abusive relationship? Am I experiencing domestic violence? Well, the one way that you can know is there someone in the relationship who has more power or control over the other one? Most relationships look like this. They're even, and sometimes they may fluctuate, where one partner has a little bit more of an upper hand than the other one. Whereas if you're in a domestic violence relationship, it's like this. Someone always has control and the upper hand. That's how you know the difference. And they use different ways to abuse. So it's the physical, it's the emotional, it's sexual, it's pure manipulation, it's fear, it's economic, it's coercion and threats, it's using children, it's stopping women from using their own abilities to get ahead or do the things that they want to do.
Understanding a relationship that has domestic violence is one of the most complex things for somebody who's not experiencing a relationship like that to understand. As society, we tend to judge exactly what we would do in that situation. We tend to say, why doesn't she just leave? Why doesn't she call the police? I would never let anyone treat me like that. I would never stay in a relationship like that.
Leaving could cause them to be harmed. It could cause their children to be harmed. There's a fear there. There's concern about the family. The children may not want to leave. They may not have a support system, or they may not know that a domestic violence agency even exists.
As physicians, we are privy to the most intimate secrets and sometimes issues that our patients are not proud of. It's we physicians and healthcare providers who can often be the resource that finally breaks through the cycle of violence and offer a lifeline to folks who can get out of an abusive relationship and potentially start their life over again.
I think as professionals we have to remember we're not only treating the clinical issue of our patients or their families, we are treating the entire person. And sometimes those persons come with stories that include intimate partner violence. Well, because we don't know as healthcare providers, we are surrounded with people all the time. And a lot of times we have no idea what people are going through. And so being able to open that conversation and have that thoughtful dialogue allows that person to then open up and share, and then we're able to triage them to the appropriate resource.
It's very important for hospitals to screen for intimate partner violence for a number of reasons. From a regulatory standpoint, many of our governing bodies require that we conduct such evaluations. It's also very important from the perspective of the patient to ensure that we examine them for all types of possibilities relative to their health care, not only those physical things, but also those emotional things that might be impacting on their health status.
The impact of intimate partner violence cannot be underestimated. In this country, we spend about $10 billion a year on the long-term health effects of intimate partner violence. There are the health effects that are obvious: bruises, broken bones, knife wounds, gunshot wounds, concussions, traumatic brain injuries. But there are long-term consequences that sometimes go unrecognized. The list that in intimate partner violence of ailments that can be associated with abuse is mind-boggling.
I think it's very important to explore the patient's health with intimate partner violence. A lot of times they have vague symptoms and they may not even realize that it's due to the violence that they've endured. So I feel very comfortable asking them about their physical complaints and their physical injuries.
And by conducting such a screen, we are able to determine things that might not otherwise come out as a part of the examination, because this is something that is quite intimate and personal to the victim. So it's not something that the individual might normally provide at the onset of such an examination.
When you ask a patient a question about domestic violence, ask with respect, to act with sensitivity, and really to act with sincerity. Certain questions you can be typing on the keyboard or writing on your clipboard when you're writing down lists of medications. But if you're asking someone a personal question about their own personal safety in their home, maybe you need to put the clipboard down or look around to the side of the computer screen, make eye contact with the patient, feel comfortable with the question so that it comes out sincere, and then I think you open up the chance of that patient then answering you honestly.
Sometimes victims of domestic violence are reluctant to come to the emergency department because they're afraid that we're going to call the police immediately. But a patient 18 years of age and older has the option if they want to report it to law enforcement or not. If they don't want to report it, then we will not call the police. It's up to them. The only exception to that is if there's a weapon involved. Now, if they're under 18 years of age, then it is mandatory reporting that we report to Child Protective Services.
We still need to have the conversation every time the patient comes in, because we don't want to assume that because they weren't ready to leave 6 months ago that things haven't escalated and now they're not ready to leave. We need to keep putting the option out there and letting the patient know that the services exist, and also letting them know that they don't have to go through this alone, that there are people out there who understand what they're going through, who are not going to judge them, who are there to help them and there to support them and to give them their feedback so that they can stand on their own.
And I think healthcare providers are in a unique position to identify victims of abuse, and if properly trained, can safely provide them with the information of how to connect with Empower House.
I think the true importance of screening is the reality that by asking one question, you potentially could have saved someone's life. When they answer, yes, I am being abused, all it takes is a phone call. You are not going to bear the burden of having to get this individual the assistance that they need.
I had nothing mentally, emotionally, and Empower House poured into me everything that this man drained out of me.
You are the best advocate because you see way more women than we ever could. We are only accessible to the women who walk through our doors or who call our hotline, who come to us personally or through a friend and ask for help. You see the 1 in 4 way more than we ever could. They come through your doors every day, every year, hundreds of women that you could ask, are you being abused? Is someone hurting you? Are you experiencing power control in your relationship? And what you have to do after that is give us a phone call. You are the best advocate. You're better than we ever could be because you reach more, because you see more, because you can do more.
Ask me. 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 Ask me.